Chapter 15, Urinary Renal System, Screencast 6. So this is the final screencast for this chapter. What we're going to do here is finish up the other things the kidney does to maintain homeostasis and also some disorders of the urinary system. Now, one of the things that the kidneys do very effectively is to help regulate blood pH. Normal blood pH must stay between 7.35 and 7.45, so that's the normal range, and there's not a lot of wiggle room there. pH is regulated by a number of factors, so the kidneys are going to play a big role here. Buffers, think of them as a hydrogen ion sponge, and then the lungs. Now, what the kidneys are going to do, depending upon the situation, it's going to impact what's happening to bicarbonate and ammonium and hydrogen ion. So that's really what's going to happen here. Now, what we're going to look at here is the reabsorption of bicarbonate. So really what's going on, you're adding more buffer to help lower pH. You're also going to be moving or secreting hydrogen ion into the tubule, so removing the hydrogen ion, which is also helping to regulate the pH, and then also the excretion of ammonium, and that is going to actually help also. And that results in more bicarbonate moving into the blood as extra buffer. If there is a decrease in the amount of oxygen that's detected by certain cells within the kidney, those cells will be responsible for releasing the hormone erythropoietin, or EPO, and that is in response to the decrease in oxygen. And what this hormone will do will actually trigger an increase in red blood cell production and in the bone marrow. We talked about this previously when we did the endocrine system, and also some of you, when you did your short paper, you looked at blood doping, and this is one of the agents that's very commonly used, and that's as a performance enhancing drug. Now, typically, skin exposed to sunlight is going to cause the production of an inactive form of vitamin D. And that's from a precursor which we all have in our skin. That inactive form of vitamin D is going to move to the liver where it's modified. So this inactive form of vitamin D is then converted into the active form by the kidneys. And the conversion of active vitamin D in kidneys is also influenced by the activity of parathyroid hormone. Usually we think of that being more involved in calcium, but once again, vitamin D is related to calcium levels also. Now, what we're going to finish up here with are some disorders of the urinary system. The first one that we're going to talk about are kidney stones. And what happens here, minerals actually become crystallized and they will block the flow of urine. I think I had kidney stones once. It was probably the most painful thing I have ever experienced before. I ended up having to go to the ED, and that was actually how they figured out that I had a hiatal hernia from some of the images, but it all came down to probably kidney stones. We already kind of talked about urinary tract infections, and they're bacterial in nature. And we also talked about why they're more common in women than men, because women have a much shorter urethra, the positioning of the urethra, and urinary tract infections can become bladder infections if they actually make their way up and also involve the kidneys. Now, there's two different types of renal failure. One renal failure is acute renal failure. This is generally short-term in nature, and it may actually be reversible. There are a number of things that are potentially causing acute renal failure. It could be someone experiencing low levels of low blood pressure for an extended period of time. There could be a large kidney stone within the renal pelvis, infections, transfusion reactions, severe injury, toxic exposure, and reaction to drugs. So these are all things that will cause a temporary decline in kidney function and sometimes be reversible. Now, chronic kidney failure, now we're looking at end-stage renal disease, and this is long-term irreversible damage, and this quite often will result in death. I actually had to euthanize one of my dogs because of her kidney failure. And we were told by the veterinarian that she probably would develop kidney failure, and that would be the real problem because of her diabetes. Now, what's happening here, basically, there is a 60% reduction in the nephrons that are actually working. And so really, they're going to have very little, less than 10% of normal filtering capacity due to the damaged nephrons. Now, what will end up happening, there's going to be an increase in toxins within the blood. The filtration is going to be blocked for too long, and all of those things can kind of result in that. I already indicated diabetes may actually lead to a neuropathy, which often progresses to chronic renal disease. Now, there's a couple of things that they can do. The first is going to be dialysis. And what this is actually doing is artificial filtration of the blood. Typically, the most successful is hemodialysis, and that actually requires multiple visits a week to a dialysis center, and the blood is actually filtered outside the body through an artificial kidney. Now, the optimal treatment is a kidney transplant. And unfortunately, one of the issues here, the availability of kidneys, but when we look at individuals that receive kidneys, we're starting to see a higher acceptance rate because we're better at matching tissues. There's less rejection. Data banks, all of this has made it a little bit easier, okay, to actually get a kidney. Now, if we look at other types, we have incontinence, and this happens to both males and females. If we look at women, and it's more common in women, causes of this are going to be pregnancy and childbirth, hormonal changes that occur after menopause. In men, incontinence is most often associated with either an enlarged prostate or prostate cancer. Remember, just because the prostate is enlarged does not mean that there's cancer. It's one of the things that happens as men get older. It's one of the reasons why a lot of men after the age of 50 have to get up in the middle of the night to urinate. Now, treatments are going to be training the bladder through various exercises, managing fluid intake, and there are also medications and surgeries that can take care of this situation.